Hi, my name's Dana Aiken. I'm the Total Joint and Spine Coordinator here at Beaufort Memorial Hospital. I'm also a registered nurse. If you are watching this video today, you are probably preparing to have a total hip or knee replacement surgery. This is our preoperative education class. Today I'm going to take you through some of the things that we want you to know to prepare you for surgery before surgery, during your hospital stay, when you have surgery, and after surgery during your recovery. First, welcome to Beaufort Memorial. Our Joint Replacement Center and our Joint Replacement Program is based on a wellness model. We take the approach that our patients are not sick, they just have sick joints that need to be replaced. With our program, we also encourage your coaches, and they're always welcome. You might hear them being called a first mate or support person. We encourage the coaches, family members, friends to come and to watch this video with you, to come to your pre-op appointments, and to come to the hospital during your surgery. If you have certain precautions that you need to follow, they can help encourage and remind you of those precautions, and we'll get into that a little bit later. So we love the support person, and this is an elective surgery, so we encourage you to make those plans ahead of time, having that support when you go home to help with your healing. We have a dedicated staff on our joint replacement unit. You will be admitted to our joint replacement center that's on the 4th floor. The 4th floor, the joint replacement hall, we don't have any infected patients down that hall. You will most likely be neighbors with someone else who is also having joint replacement surgery or some sort of orthopedic surgery. So we do have specially trained staff that are familiar with how to take care of the joint patients. Our hospital stays are very short for our joint replacement patients. We will get you up and moving very quickly. Again, we are based on the wellness model, and the expectation is to get you up and moving within 4 hours of your surgery. If you're able, we have physical therapy come and work with you and get you up same day. We also have same day discharges. If you are going to be a same day discharge, that is something that you should discuss with your provider. That would be a decision between you and your provider, and a good question and something to talk about at your pre-op appointment. Our program is also an advanced certified total hip and knee replacement program by the Joint Commission. We are one of 4 in the state, so we're very proud of that. We also have the Blue Distinction Plus by Blue Cross Blue Shield Hospital for hip and knee replacements. If you have your joint replacement book, you can follow along with me as well. We have the knee book is separate, and then we have an anterior hip replacement book. We also have our posterior hip or just a hip replacement book. There are certain things in the anterior hip versus the posterior hip replacement that are a little bit different as far as your restrictions and maybe some exercises, but everything else is pretty much the same. So if you have your book, you can kind of follow along in there with us as well, or the slides are up for you. So the first thing is to understand your joint replacement. This is something that you probably have already talked about when you decided to have this procedure with your physician. I'm sure that you've had some x-rays done and maybe some other things that led you to come to this decision. You should have discussed your model and the implant in the office with the physician. If you have not, or if you have any questions prior to surgery, please make sure you jot those down, take those to your pre-op appointments, reach out to your provider. We want you to be comfortable and make sure that you have all your questions answered before you go into surgery. So over time, as you can see, the before and after, our joints, the first picture is a picture of the knee, the hinge joint. Just over time, the osteoarthritis kicks in and we have the wear and tear in our joints. Our joints a lot of times are kind of like tread on the tire. They wear and tear. Over time they wear down, and you don't have that nice healthy fluid or space in between. So after probably several conservative measures, it is time to replace the joint, which is what you see in the after. So they just go in and pretty much just replace the parts that are damaged and worn down. The other picture you see here is the hip, the ball and socket joint. So that just kind of shows you how it's going to look a little bit. And again, if you want to discuss specifics, your approach, your implant, that is something that needs to be a conversation between you and your provider. So a couple things that we want you to understand or think about before surgery, or just know before surgery. You will have a preoperative evaluation that identifies any medical or physical conditions, known and unknown, that could cause surgical complications. Again, this is an elective surgery, so we like to make sure that you are optimized and that we've looked at everything we can possibly look at before you go into surgery to prevent any complications after. You will normally receive clearance from either your primary care, or majority of our patients go through the preoperative assessment clinic. They are referred by your surgeon, and they will give you clearance prior to surgery. Some examples of things that we look for are your iron levels, any UTIs, any lung conditions, the MRSA staph infection. We will treat that if you have a positive result, and there are some measures that we put into place for that. And any cardiac issues, anything that you might not be able to go to surgery, anesthesia will also review your records, and we just want to make sure again that we have optimized everything that we can optimize that would prevent you from going into surgery or prevent you from having complications after. A nurse will also review your health history and your medications in detail. You will have a preoperative nurse call you, and they will go over your medicines to stop taking, your medicines to take the morning of surgery. So just expect those referrals and tests and phone calls. I mentioned earlier that we will check your iron levels. The blood conservation program is something that is a very big part of our program as well. Prior to having surgery, we will review your lab work. If you're somebody that has a history of anemia or an iron deficiency, or somebody who has had infusions in the past, you will probably most likely be referred to our blood conservation program. We do have a blood conservation coordinator. If you have any questions for her, if you're somebody who has had something in the past or just wants to look into it further, her number is here on the screen. We are again trying to reduce any risks of needing a blood transfusion or any iron deficiency after surgery, so we will kind of build you up, whether it's orally or intravenously before surgery. Again, we will know that, and you will know that before you go in. We will know that if you're somebody who needs to be a part of the blood conservation program. So we talked about earlier ensuring the best outcomes, especially because it's an elective surgery. So to do that, we have to focus on the surgical risks. With every surgery, there are risks, and we, again, have the opportunity to put some things into place to reduce some of those risks with these elective surgeries. So we're going to go into these, and I'll mention a couple, and then we'll go into some of them a little bit further. So blood clots are always a risk of surgery. We will do things like put you on a blood thinner. All of our joint replacement surgeries go home on some sort of blood thinner. The type of blood thinner and the length that you will be on your blood thinner will be coming from your surgeon. Those conversations will be had sometimes preoperatively. You'll know the plan, but definitely before you leave the hospital, you should feel comfortable and know the plan before you leave. If you are already somebody that's on a blood thinner, There will be conversations about when to stop your blood thinner before surgery. And then they will definitely let you know the plan for what to do and how to take those after surgery. So if you are somebody, again, that takes one of those, please make sure that you are aware that that is a big part preoperatively and postoperatively of the plan, and to know the plan. That is also something that you can talk about with the pre-op nurse that calls you, and then again at your pre-op appointment with your surgeon. Infection is also something that we look at and want to reduce the risks of. So one of the things that we put into place are the HIPAA cleanse. We'll talk about the shower prep. We'll go into that a little bit further. We give you some pointers on things to do before surgery to reduce those risks, so we'll get into that. You also always have the risk of nerve, vessel, or ligament injuries, poor wound healing, so we'll talk about that a little bit. Limited range of motion for the knees. You'll get some exercises and some instructions for your hips and knees. It's very important to follow those and to understand maybe the why behind them. So it kind of helps you follow them a little bit better. So we want to, a lot of these too, with the limited range of motion for knees, might be dependent on what your range of motion was or your ability was before surgery. But again, we'll go through that with physical therapy and further on in these slides. We want to reduce the risk of hematomas. Any instabilities and loosening are also part of surgical risk. And then with hip replacements, you always have the risk of dislocation and then changes in the length of your legs. So we'll go through some of that. So we talked about one of the risks that we worry about and that we want to try to reduce are blood clots, which also you might hear them referred to as a DVT, or pulmonary embolisms, PE, and that's a blood clot in your lungs. So we will monitor for these things while you're here, but as we talked about before, sometimes your stay is same day or next day. So we do want you to know the signs and symptoms when you get home. We want your coach to know the signs and symptoms, or your support person to know the signs and symptoms. So some of the things that we put into place to prevent these are taking a blood thinner. Again, every patient will go home on some sort of blood thinner. Make sure you know the plan and are comfortable with how to take it and what you're taking. The mobile, we want to get you up and moving as soon as possible. Our goal is 4 hours after surgery, but you should be moving same day. If you have complications that prevent you from doing that, we will talk to you about that. You'll be very aware of what's going on. Your surgeons will also be aware, but mobility is one of the ways to prevent the blood clots or the pulmonary embolisms. And then as soon as you wake up from surgery, you will feel some foot pumps, or we call them the SCDs, the compression devices that will kind of squeeze usually on your feet. And those are helping the blood flow while you're even just laying there in the bed to help prevent some of that and reduce those risks. Some signs and symptoms when you get home or while you're here that you would want to call about. If you have, for DVTs, we look for the pain and swelling. You will have some pain and swelling after joint surgery. That is very common. We expect that. So if you do have that, use your ice, your elevation. But if you're icing, you're elevating, it's significant changes. You have done the elevation above the heart and your pain and swelling is not relieved. That would be when it's time to definitely call the doctor. When in doubt, though, if you are concerned, it's definitely good to have a conversation. You don't necessarily have to rush to the emergency room for that pain and swelling, but it is definitely something to call and just discuss with your provider. We also look for the reddened area of the skin and skin that is warm to the touch. So those are all some signs and symptoms. Again, the redness, pain, and swelling can also be just something that we expect after surgery. But the big question is, are you icing? Are you elevating? Are you doing all the things and you're still having this? So those are just something to discuss and be aware of. If you have the signs and symptoms of a pulmonary embolism when you go home, those are usually things that are emergent and something that you would want to call 911 for. So if you're having a significant change in shortness of breath, rapid heartbeat, chest pain, lung or rib pain, or just feeling faint, sometimes people will say they have that feeling of impending doom. Those are all things that would be a major concern and something that you definitely want to call about. Again, take your blood thinner, move, do your ankle pumps. When you get home, you won't have the SCDs or the foot pumps, so you're doing your ankle pumps, your exercises, those are all ways that you can reduce these risks. Another risks that we talked about are surgical site infections. So reducing the risk of the surgical site infections, some things that we can do are just maintaining a good physical health, eating nutritiously. So, low sugar diets, protein aids in the healing of your wound. So just after surgery, eating nutritiously is important as well. Avoid shaving for 48 hours prior to surgery. So if you have any open areas, especially around your surgical area, that is something to notify your physician for and to discuss. If you're diabetic, we want to make sure that you're controlling your blood sugar, keeping your blood sugar in a controlled range is something that will also reduce your risk of surgical site infections and aid in your healing. If you're a smoker, we highly recommend that you stop smoking, usually 30 days before. So smoking and nicotine use can also increase your risk of infection. It can delay the blood flow to that area to help with the healing. So something to look at. Dental work, if you are scheduled to have a dental procedure, we suggest all dental work to be completed 3 weeks prior and avoiding 3 months after. If it's just something that you really, really need to have or that you're really concerned with, it is something to discuss with your surgeon and your dentist, especially after you've had your joint replaced, making sure that they both know that you just had a joint replacement and that you might be thinking of having a procedure. That's just something that they would need to know to plan for. And we recommend that you don't do anything in that time period. Just, clean and wash your hands, report any illnesses to your provider. If you have any changes from the time that you're watching this video to the time of surgery, that's something that you should definitely let your provider know, just so that they can, make the proper adjustments if they need to, or possibly reschedule your surgery. We want you to follow the shower instructions with your antiseptic HIPAA cleanse 5 days before surgery. Those instructions are in your total joint book. And if you have any questions, definitely reach out. So to get into that a little bit further, for your pre-op shower instructions to reduce your risk of infection, we give you this HIPAA cleanse. If you are somebody who can't use the HIPAA cleanse because you're very sensitive, any kind of antimicrobial soap or antibacterial will do fine. If you run out or just want to be extra, you can use that along with this. So for the pre-op shower instructions, the directions are, we would like you to start this regimen about 4 days prior to surgery. You're going to shower as regular, use your regular soap, rinse regularly. Once you rinse, then you will apply the HIPAA cleanse. You want to stay away from your face and your genital area. Usually you apply it from the neck down. Starting in your surgical area, you will wash with this soap, and then you will just rinse as usual. Once you apply it, we like you to leave it on for a couple minutes. So rule of thumb is sing your favorite song or whatever you'd like to do, cut the water off just to make sure that you let it sit for a little bit, and then rinse as usual. When you are finished with this, you'll put on clean clothes and get in a bed. Make sure that you have clean sheets. We are creating a little bit of laundry for you, so we apologize for that. Do not sleep with pets once you start this regimen. And then after surgery, when you do come home and your wound is healing, we recommend that you don't sleep with your pets as well. And then the morning of surgery should be your last shower with this soap. If you want to test this soap out and just do a small area, make sure that you're not going to have any reactions to it. That is something we recommend. Also, you don't want to wear any deodorant, solution, powders, or perfume the day of surgery. Once you start the regimen, you can do deodorant prior, just not the day of surgery. If you have any questions about this, please give us a call. Another thing we do is the pre-op nutrition to help your body prepare and recover from surgery. Again, remember, we like you to be as optimized as possible. We do sell this Ensure pre-surgical drink in our hospital gift shop and our hospital cafeteria. You can get it on Amazon. Some people have found it at Walgreens. If you are not able to purchase it from one of those places or can't find it, you can have an alternative is the Gatorade or Powerade. No red color, and it must be clear. This is a clear carbohydrate drink that has shown to reduce some post-op nausea, vomiting, reduce some post-op dizziness. So again, just kind of boosting you and optimizing you for surgery. The day before surgery, we like you to drink 1 10-ounce bottle. Again, nothing to eat or drink after midnight, but you're going to drink that the night before midnight. And then on the day of surgery, at least 2 hours before your arrival time to the hospital. So it's your arrival time to the hospital, not your surgical time. If you could drink it at home, not in the car, not once you get here, you want to do the 1 10-ounce bottle again prior. You want to drink it quickly within 5 minutes. If you are diabetic, there might be some different instructions for you. So if you have any questions about any of these drinks or how to do it, how to take it, definitely give us a call. That is something that we get a lot of questions about, so don't hesitate to reach out. So again, we talked about smoking earlier, just kind of reiterating a little bit. If you smoke, please stop. The cigarettes and smoking can carry toxins, which transport the oxygen, so they really can affect the healing and recovery. Our recommendation and for best possible outcomes is to stop smoking and using nicotine at least 30 days prior to your surgery. You will have a pre-op checklist in your book. I love checklists, so this is something that kind of helps keep you on track, getting you ready for your surgery. So refer to that. It's on page 13 of your knee book. And it's in all of the books, but it starts, even 4 weeks before surgery, 2 weeks before surgery. So just check that out, kind of go through it. It kind of helps organize all this information. And some highlights here are making sure you know when to stop your medications, removing fake nails and nail polish, making arrangements for transportation to the hospital, making sure that you have that coach or support person at home. For after surgery, you may need a front-wheeled walker, or you will need a front-wheeled walker for ambulation. That is something that you might want to prepare ahead of time. If you don't have one, we will make sure that you have all that set up prior to going home. And then it's a good time now, preoperatively, to make arrangements in your home, just making sure that it is safe. Are you able to get the walker through your home? Do you have any rugs that might trip you up or anything in your way? And then go ahead and, get ready, pack a bag, bring a change of clothes, something comfortable. Make sure you have some good shoes with traction. And you don't really need to bring any valuables with you. But if you want to bring your phone and your charger, things like that, go ahead and get all those things ready. If you have glasses, if you have a case or teeth that come out or hearing aids, I would bring those cases with you as well. And that jumps into what to bring to the hospital. So again, your Joint Connection Resource Guide has a list and has something in there that tells you all the things that you might think of bringing. The footwear is important. We talked about that, the comfortable, loose fitting clothing. If you have a CPAP or BiPAP that you use, you can bring that. We will check that out and get an order from your physician to use that. We do offer Publix bedside delivery. If you are somebody who wants to use that, it is just something, a convenience that we offer here. It's no extra charge to use the Publix bedside delivery. Once you get here, you will just let the nurse know. If your surgeon called in your medicine to the pharmacy, already you would not use Publix bedside delivery, but if you have any prescriptions, you are able to use those if you choose. That is just a service. They come and deliver your medicine to you. You might need a small form of payment for any copays that you would have normally at any other pharmacy, so you can bring that with you. Some of our blood thinners, they are expensive, so we do have coupons. We work with our medication reconciliation team, and they help with coupons and getting those to you. So if you, on that note, if you're somebody who had a blood thinner called in prior to surgery and it is very costly, please reach out, because we can make arrangements for those coupons to be used for you as well. You will be called the business afternoon prior to surgery to inform you of your arrival time, so be expecting that call as well. So again, we talked about preparing the home for surgery, just making sure that you have good lighting, your stairs, furniture, all the things are in place to prevent any fall hazards for you. Decide which car you're gonna bring, or one that might be a little bit easier to get in and out of. We will go through these things while you are here. If you're someone who has a lot of stairs, we will show you the stairs before you leave the hospital. So just think about some of those questions that you will have for the physical therapist and occupational therapist, and then just start preparing your home now so that when you get home after surgery, it is ready to go for you. On the day of surgery, so again, nothing to eat or drink after midnight. Do your pre-surgical Ensure drink, and then make sure that you take your HIPAA cleanse shower that morning. Don't wear any deodorant, lotions, powders, or fragrances. Remove all nail polish and fake nails. Again, you'll receive that call the day before to let you know what time to be here. Anesthesia will do their assessment, and the surgeon will visit you the day of surgery. So if you have any last minute questions for the anesthesiologist or the surgeon, make sure that you prepare and bring those in with you so that you can ask those. So now you're ready for surgery. You're gonna arrive at the hospital that morning. Right now, our normal surgical entrance is entrance number 4, the surgery pavilion and birthing center. We are under surgical renovations. So this is a long project. So just make sure that when it's time for your surgery, you know where to check in and where you will be picked up on discharge. You're gonna check in at the surgery lobby desk. They will prep you for surgery. You'll be wiped down and you'll have some nose to toes treatment. Just again, doing any last minute wipe down of the skin just to reduce that risk of infection. If you have any hair that needs to be trimmed, we'll do that too. They will check your skin, make sure that there's no open areas. Again, you'll meet your surgical team and have an opportunity for any last minute questions. After surgery, you will go to the recovery room, or what is called the PACU. Your family members will not be allowed in this area. When you wake up, it may be noisy and bright. You may see other patients who are recovering from surgery. There will be a lot going on. We have some, you'll have a lot of equipment attached to you. You'll probably have an ice pack on you, so it might be cold. We talked about the foot pumps that will be squeezing your feet. And then if you're having hip surgery, you may have a wedge between your legs to help you keep those precautions. So just some things to expect after. And then your family, once they've talked to the surgeon and know that you are out of surgery and in recovery, while you're in recovery, they are more than welcome to wait on the 4th floor where the Joint Replacement Center is. You will probably already have a room assigned to you, but again, they can communicate with your OR team in the process of where you are and where they need to wait. based on that. After surgery, we will focus on managing your pain and preventing any nausea. Please communicate with your nurse if you are experiencing any nausea or pain. Pain medicine is not something that is brought automatically, so we will want to stay on top of that, and it's very important for you to communicate that to your nurse. If it's not working, let them know. Again, some of the pain medicine will cause some constipation. Not moving will also increase your risk of constipation, so we like to focus on that and do a little bit of preventative medicine before with some stool softeners and then some laxatives if necessary. Drink plenty of fluids and eat foods with high fiber. Again, not moving around, and those narcotics can increase your risks. So that's something that you want to be aware of and communicate with your nurse if you are experiencing any of these things. After surgery, you will be taken again to the 4th floor of the Joint Replacement Center. Your recovery will begin right away, going back to that wellness model. So if you've met all your discharge goals, you might go home the same day. This is something and an expectation that you will want to discuss with your surgeon prior to surgery. That can change, but if it's something that you are trying to do, definitely have that conversation. You'll be on the 4th floor with the experienced joint replacement nurses. You might be offered the flu vaccine or pneumonia vaccine if it's flu season. So expect that question, and your team will monitor your vital signs. They'll monitor them a little bit more frequently right after surgery. We will monitor your bandage, making sure that you're not having any drainage. We will make sure that you're able to void and you're urinating properly after surgery. We will focus on your coughing and deep breathing, showing you the incentive spirometer. Remember earlier we talked about reducing your risk for a PE or pulmonary embolism. So using that incentive spirometer is one way that we do that. Your pain management, again, we like to keep your pain under control in a nice even pace. You don't want to have that spiking. They'll probably ask you, rate your pain from 0 to 10, 0 being the least, 10 the worst you've ever had in your life. So have those conversations, lots of conversations with your nurse to make sure that your pain is controlled. The pain can be a little deceiving. Usually people will tell us their second day is the worst. All those things are worn off after surgery. So just make sure that you have lots of conversations with your doctor and your nurses to have a good pain management plan for you and understanding how to take your pain medicine. Your diet will make sure that you're tolerating food and you're able to eat after surgery. Your activity, again, you will be moving with therapy pretty quickly after surgery. You will move with your therapist or nursing. We don't ever want you to get up alone. If your coach is there, it is a good idea to have them so that they can see how you're moving, how well you're moving, and just any restrictions that you may have or any instructions that you may have on your moving. When your goals are met, some will go home again same day. So after surgery, again, you're going to ask for assistance at all times. Your safety is our primary concern. You may have some early morning blood draws or lab work, especially if you're somebody who was part of our blood conservation program and we're monitoring you a little bit closer. You will be up to the chair during the day. If you do stay the night over, your physical therapy sessions will happen the day of surgery and the next day if you stay over. If you're somebody who's having a hip replacement, you will see occupational therapy. They will show you how to get dressed, how to shower and bathe using your precautions. And then again, we'll monitor any pain and nausea, and then you will have a visit from the care coordinator. The care coordinator will make sure that you have all your equipment before you leave, and they'll make sure that you have your discharge plan for your therapy is set up as well. Again, physical therapy will work with you usually twice daily, especially on that next day if you need the second therapy session. If you've met all your goals at the first session, you may leave after that session. You'll be learning to walk with your front-wheeled walker and using your new joint, getting in and out of bed, getting out of the chair, onto the toilet. They'll focus on circulation and strengthening range of motion exercises, going over your home exercise program. Any safety precautions that they want you to know, they'll go over that as well. Occupational therapy will focus on your activities of daily living for your total joint patients. Again, your showering, bathing, dressing, energy conservation. They will give you some equipment that you might need, the reacher and the sock aid, long handle sponges, and the shoehorn to help you keep those precautions that they go over with you. Preparing to go home, make sure that you talk to your family and friends and determine what type of help that you have. And after surgery, you'll know, kind of where you are and what you're able to do. Make sure that you have your first mate established. You have someone at home to assist you. Have a plan of who's going to drive you home, drive you to your doctor's appointments and your therapy appointments. You won't be able to drive while you're on pain medicine, and you may not be permitted to drive up to 4 to 6 weeks after surgery. So make sure you have a plan for that. Your care coordinator, again, will arrange and make sure that you have equipment and your follow-up services like therapy established before you go home. So care coordinators will round on you in the hospital. There are some options that you will discuss with your surgeon prior to surgery at your pre-op appointment, whether you're going to do home health care, physical therapy, an outpatient therapy at a clinic, or a bridge to home where they come into your home and do some therapy sessions and then you bridge to the outpatient. Your durable medical equipment will also be discussed on your care coordination visit in the hospital. So if you already have a front-wheeled walker with the tennis balls on the end, or go ahead and pull that out. If you have any equipment that you're just not sure about, we can go over that with you as well. And then if you want to purchase one, insurance may cover your walker, they may not. There are some areas. We have a lending room that's right across the street from the hospital. You can get those over there. They have those available. So just have a plan for your equipment. If you do purchase equipment, keep it for about 5 years because your insurance doesn't usually cover it. So if you just got a walker in the last couple years, your insurance may not cover a new one. So maybe the lending room is somewhere for someone like you to get another one if you got rid of the first one. We can order it again through Resource Medical here at the hospital, but you may have some uncovered expenses. So just things to think about. If you have any specific questions for you, definitely reach out. The shower bench and the shower seat are something that we recommend. We recommend that you sit down while you're taking your showers, especially the hip patients, to stay in those precautions. You might want a raised toilet seat if you have a low toilet. So we call them potty chairs, shower chairs, a 3-in-1. They can serve more than one purpose. When you're getting dressed to conserve some of that energy and to keep your precautions, you might want to have one of these, and these are not covered by insurance. So again, if you want to start thinking about these things prior to having surgery, and this is a picture here of the lending room information. So again, right across the street from our hospital, you can reach out and see if they have something that you can get before purchasing. So preparing to go home, you will have a discharge checklist. You have a discharge checklist in your book as well. It's something that is good for you to make sure that all these things happen. Your nurses are going to be making sure that they're all checked off before you go home as well, but it's always good for you to know and for your first mate or coach to know. So your incisional care, and you want to keep your wound clean and dry. You want to watch for any signs and symptoms of infection. We discussed some of those earlier. They're listed here as well. Just call your doctor if you have any questions. You can also reach out to me if it's not emergent and you want to talk through it. So wound care, the big thing is just keep it covered. Your wound that you get in surgery is going to be your cleanest wound. You won't have any dressing changes or anything like that. Your physicians are the ones that will change those for the first time or remove those for the first time. But we will go over your wound care and instructions prior to going home, so make sure that is part of your discussion. Prevention of blood clots, any signs and symptoms of the PE and DVT are something that you will want to make sure you feel good about before you go home. Your blood thinner, you'll want to know what it is, how to take it, and when you've had it last before you leave the hospital. And then control discomfort, so your pain medicines and side effects, ice packs, positioning. Just make sure that you have had those discussions with your nurses or with your care team prior to going home. For knees, just remember some things to remember. Do not put a pillow under your knee in a bent position. We will go over this with you while you're in the hospital. You want to try to keep your knees straight, reaching that zero extension if possible. You can expect some swelling in your knee like we talked about. You want to rest it. Ice, we will give you ice packs to go home with the holder, and you will go home with 4 ice packs, so you'll always have 2 fresh. Do your ankle pumps, your quad sets, and your glutes. Again, we'll go over these with you with physical therapy before you leave, and then elevating to reduce that inflammation. Preparing to go home for your hips, so posterior and direct superior precautions. Do not bend the operated hip past the 90-degree angle. Don't cross the midline of your body. Do not rotate the operative leg inward, and sleep on your back or side with the pillow in between your legs. These are precautions that they will go over with you. Physical therapy and occupational therapy will go over these with you. They're the reasons that you want to use the tools that we give you. We talked earlier on in the class that, one of the risks that we look at is dislocation for the hips. So these are the precautions that we want you to use so that you don't experience a dislocation. So very important for you to understand and remember. Make sure that you feel comfortable with these instructions before you go home. Make sure that your coach or your support person is also comfortable with these before you go home as well. Your hips for the anterior, a little bit less restrictions. Do not extend your leg behind the body or kick it back, and then do not turn the operative leg outward. Some post-op instructions, your nurse will go over these and give you a copy. Again, we've talked about a lot of these already. Walk with therapy as instructed. Call your doctor if you have any wound care questions. Take your medicine as prescribed. Again, remembering the narcotics can cause constipation, so have a plan for that. Talk to your doctor about when to begin your herbal supplements or any medication that you stop prior to surgery. Stopping them before surgery might not mean that you can start them the day that you have surgery. It might mean that you need to wait another week or 2 after surgery. So have those individual conversations, know those instructions before you leave the hospital. A lot of them have been stopped because they increase your risk of bleeding, and you're going to be on a blood thinner after surgery. So they may not want you to start some of those after surgery right away. So make sure you know the plan for those. Also, again, make sure you know the last time that you've taken your blood thinner and pain medication so that when you leave the hospital, you know when your first dose is due at home. You might have already received, or you will receive, a text or email for our survey. That survey is coming from Beaufort Memorial and from our program. We focus a lot on the patient-reported outcomes. Those outcomes are sent to me. It's another way to communicate with you all. We monitor and track your recovery before surgery, after surgery, 3 months, and then a year we check in. So please just check your emails and texts so that we can track your improvement and just make sure that your joint replacement is doing what it needs to do and getting you back to that quality of life. Okay, so we have gone over a lot today. If you have any questions, please don't hesitate to reach out. That is why I'm here, to be a resource for you before surgery, during surgery, after surgery. My office number's here, my email's here. If you call and I'm not in, please leave a message. It goes also directly to my cell phone, so very easy access. Your provider will also have somebody on call 24 hours a day. There is a page in your book just of numbers and resource numbers for anybody that you might need. So definitely check that page out and look at those helpful phone numbers. Don't hesitate to reach out and call. We want you to be as comfortable and feel like you are as prepared as possible to have this surgery. Thanks for joining us today, and I look forward to seeing you get back to your quality of life.